Hey everyone, and welcome to the Psyched to Practice podcast, your one stop for practical and useful clinical information, masterful insights from experts in the field, and a guide to daily living. I'm your host, Paul Wagner, and today we're taking a look back at some of our early episodes. Specifically, we have a trio that are all focusing on words, whether it's the word we use, how swear words can be used in treatment, as well as body language, paraverbals, and really kind of all the things that aren't words. And Ray and I have an upcoming episode where we're going to be focusing on the word we say to ourselves, and wanting to take a look back and just see some of these previous concepts and really how they've blended together and have been a part of the conversation all along. So we hope you enjoy this looking back practice and action episodes. Words, words, words.
I'm always interested in words, but when it comes to kind of thinking intentionally about words, this kind of goes back to my doctoral work. When I did my doctoral work, my first year as a doc student, we used to do something called standardized patients, where all the doc students would see a patient with similar difficulties. They were actors. And then we would get recorded and get feedback from professors. And kind of a shout out to Dr. Bruce Zahn at PCLM. He was the first professor I had interaction with this. And, it was really a simple exchange. When I started my session, I used the phrase something like, "What brought you in to see me today?" And I get those words out, and Dr. Zahn pauses the tape and looks at me and goes, "Wow, is that really what you wanted to ask?" And I said, well, yeah. And he said, but he's like, well, what brought them to therapy was probably a car. And he's like, isn't it what you wanted to ask was why they were there to see you? And he used that in that conversation, used the terms, remember your words matter. And I've kind of held on to that. And I've since then become very intentional in my words and paying attention to what I say, when I say, and what reaction I'm going to get from it. So I'm excited that we're kind of talking about this.
Yeah. And, speaking of these conversations, you and I were talking, you had shared this story and, we threw it out there as an idea, and it really made me stop and say, okay, why do I think words matter? And I really felt a connection to that topic. And yet on the surface, I didn't really know why. So I spent a bit of time thinking back, and I can just remember growing up. I feel like I was a bit conflict averse, still am, gotten much better with it. But the words I would use could help take me out of conflict within situations. And it wasn't trying to necessarily be avoidant of those conflicts, but rather working to resolve them in a way that I didn't have to sit there in that discomfort for much longer. So I really worked to be intentional with the words that I used. And that was probably the first thought that came to mind after we were talking about this idea for words matter. We have to learn not only to be very mindful of our body language, but also being able to read body language as well. If we're going to be effective clinicians, and how important that is. And, because body language and paraverbals, they're pervasive. It's not just in the therapy setting. I think we can almost most naturally notice this in our personal lives. Yeah. And as we're talking about this topic, just a recent event comes to mind where my fiance and we were walking across the street, and she did something with her hands where she just kind of made a small hand gesture, and she stopped herself and she said, I'm doing the thing that you do. And now that caught me by surprise. I'm like, well, what are you talking about? She's like, well, when you get excited, you talk with your hands and you do this gesture when you're trying to think of something or when you're trying to convey something. And I had no idea. And now as time has gone on, as I'm seeing her do this more, I'm recognizing she's excited, and this is like a bit of mimicking there. But it's something that I didn't recognize that I do myself, that she really heavily recognized and then caught herself doing. So, it's there in our personal lives. It's there just about in every form of communication we can have.
Yeah, I mean, I think that, and that awareness, I think, is interesting. I think we're really good at recognizing body language in everyone else. You were talking about, your fiance. I think, I probably understand more from my teenage daughter from her body language than her words sometimes. Both whether she's agreeing with me or not, there's that information. But I think, your example, I think, is important because it also helps you kind of recognize to pay attention to your own body language, right? And to notice that in yourself. And maybe we're not as good at that.
And it really makes me think of just the most important relationships in my life and the significance that I always want to give my words with them. And also the ease where I lose sight of that. And I think that's where oftentimes I also get into the most trouble with those relationships, or there's the greatest kind of disconnects, is when I'm choosing my words poorly, or I'm not really putting that intention or specificity in there. And I think that's something, as you're talking about, not only the words we say or how we say them, it allows for connection.
Yeah, an observation, that I think I have is, I think a lot of times we move to just letting words fly out of our mouth, right? We say things and they're very punctuated in how we say them, and sometimes even meaningless. And, maybe an easy example is, how often do we use something like, "How are you?"
Doing good. How are you?
Right. That's the response, right? It's, I'm fine. I'm good. But are people, right? Like, is that something that we're saying, and it's more a greeting than it really is a communication, and how do we change that? Like, is it different if I say, "Paul, great to see you. How have you been?" Does that change it versus this reflexive kind of, "How are you?" I don't know. What are your thoughts?
It felt different. Yeah.
It felt different. Right.
It did. And I think you're absolutely right. If we can put intention behind our words, I think that's when they carry the most meaning. And it's a redundant sentence, but I think it still holds true, that if we are able to hold our words with care and choose them with purpose, that we can help to evoke the actions or reactions that we're hoping to, but carelessness kind of leads us up to mistakes or to areas that we weren't expecting. And then we have to scramble to make it work.
Or we just get a reaction or a comment from other people that is just as meaningless as what ours was. The CBT person that I am, I almost frame it for people is, it's more helpful for me to really know what you say to yourself. Like, don't filter it because I'm going to be offended. Like, if that's how you say it in your mind, that's important, because I do think, saying darn versus shit does have a difference. And so we can frame it, I think, a whole lot of ways, and giving them permission, I think, is important. I guess a thought I had was, so when is the time that we tell a patient that their swearing goes too far? Like, when do we, do you ever stop them? Like, is there a time where you go, all right, this isn't appropriate for my session?
I referenced it a little earlier, but I think when it starts to feel like a negative feedback loop, and where it's creating resistance to change or growth rather than promoting it, I really look out for that. And I also look out, like, there's specific contexts where I've had 5-year-olds sitting in the room, and the parents are distraught because they're about to go into school, and their child is dropping. Again, it's shit, fuck, asshole. Right. And they're so worried about that, and being able to establish, hey, okay, this is not appropriate. This is not okay. Because one, there's an authority figure here who's saying that it's not okay. And also there's going to be consequences and ramifications. And I try to connect it a lot of times with that of, how do we work with this system, and what system are we in? And so if it's school, if it's with parents, or in a household where, like, hey, this really isn't okay, trying to model that in a way that doesn't feel shaming or judgmental, but rather connective with, why am I saying this? And can you connect with why I'm drawing attention to this in this moment? The 5-year-old sometimes has a hard time hearing that, but being able to hear that, hey, that makes me feel uncomfortable. I can imagine that makes, your friends feel uncomfortable sometimes. Okay. That might get a pause. That might also reinforce the behavior a little bit if it's attention seeking, but it's being able to work to set some of those boundaries. But I think if it feels like it's no longer promoting change, that's when I try to limit it some.
Yeah. And I mean, I think along that line, I mean, maybe part of this awareness is also paying attention to our own response to other people's body language. I've been in situations where people were asking me questions with their words and their body language is, hey, I can't wait to get out of here. And I have to pay attention to that and just my own kind of reaction to that. I think doing that does help us prepare. And then, again, practicing and being able to say those things comfortably to people. It's important, and I think on the other side of it is really paying attention to then the other person's nonverbal. So, I mean, part of adjusting ourself is to also have awareness of how the other person's reacting.
And I think if we can read that and bring that to light in some ways, right, then that can feel so helpful. Just this week, something akin to this happened where, as I was going to sit down with a client I was seeing, my thumb caught my shirt button as I was going, and it popped the button down, and it happened right as I was sitting, and we started kind of getting into things. And I didn't want to necessarily stop and kind of derail things. So I just kind of crossed my arms over that. And for like 20 minutes, I'm sitting here with my arms crossed. And as I said before, I talk with my hands quite a bit. And so I'm not doing this and I'm feeling myself, it's not connecting.
Right.
And we just so happened to be talking about the idea of accepting help and how it felt uncomfortable for him. Right. And, we're really trying to kind of talk about, why is that? And we land on embarrassment. And it felt like a valuable moment to share how, what is the embarrassment doing? It's supposed to be protective, but in that protection, it's limiting him from being able to kind of move freely or being able to do something more efficiently. And I called myself out on it, and, I was embarrassed and I said, hey, speaking of, and I explained the situation. My button popped and I'm going to take a moment and fix it. Now I don't have to sit here with my arms crossed the entire time. Right. Now I can connect, and it really connected for him. And so when he's kind of talking about, and, he's uncomfortable talking about help, he's uncomfortable talking about embarrassment, and I can feel that body. And the moment I called myself out, I felt more relaxed, but I felt him be more relaxed. And so it was just kind of this opportunity, I think, to bridge not only nonverbals and connecting, how that can happen, but also in the calling it out, being able to then say, this is what doing something about it and being able to effectively move on from it looks like.
One of the other things that we're talking about kind of came to my mind is I've actually had times where I've, for lack of a better word, prescribed swearing, where I've said, like, listen, you need to use an intense language to evoke an emotion, to almost charge you up. There's a great TV show. If somebody wants to really be into swearing, Nicolas Cage hosts a show on Netflix called The History of Swear Words. They talk actually on that show about research that shows if you swear, you can tolerate pain better, like physical pain, like they do. And they do all these great experiments on the show. But, there's really research to show that. And I've had patients, specifically patients who have some emotional turmoil and they're having a hard time dealing with negative emotions, to say, like, listen, like, I don't want you to say, oh, I don't want to be sad. I want you to go, shit, I hate being sad. Like, that's different. Like that swear word almost can bring a little bit of an intensity to help pull them in a direction.
And to mirror, and I think it was one of my takeaways previously of that idea of striking while the emotion is hot. We need the emotion to be hot to be able to forge the change. And words matter is the theme that we were talking about, but I feel like there's that subtext that says the connection that they bring. And, it's so important that we as clinicians, as we're using them, that we're saying them with a specific intent, but we also have to ensure that they're being interpreted with that specific intention, because they do have the power to hurt. And, for us, I feel like our purpose is to promote change and promote growth, for those that we serve. One of the most crucial ways that we need to recognize that is with our words. Words matter. Well, and with that, I think that's all we have this week. We hope you join us next week. But until then, be well, stay psyched. The information contained in this podcast and on the Psyched to Practice website is intended for informational and educational purposes only. Nothing in this podcast or on the website is intended to be a substitute for professional, psychological, psychiatric, educational, or medical advice, diagnosis, or treatment. Please note that no professional patient relationship is formed here, and similarly, no supervisory or consultative relationship is formed between the host, guests, and listeners of this podcast. If you need the qualified advice of a mental health professional or practitioner, please contact services in your area. Similarly, if you need supervision on clinical matters, please locate a supervisor with experience to fit your professional needs.